Welcome to our Grand Rounds webinar, Environmental Sustainability and Resiliency Goals, Approaches and Challenges in the Construction of a New Hospital Building. My name is Winnie Armand, and I'm a physician at the Massachusetts General Hospital in the Division of General Internal Medicine and a member of the MGH Center for the Environment and Health. And I'm really pleased to be here with our colleagues from MGH, Mass General Hospital, Institute of Health Professions, Center for Climate Change, Climate Justice and Health, for our co-sponsored educational series as we focus on topics at the intersection of climate, the environment, and health. And really pleased to see all of you joining us and see all you interested folks in promoting healthcare sustainability. And as more people join in, I'm just going to go through some housekeeping issues and then we'll get into the talk. First, you'll note that I believe closed caption is available, although I apologize if that's not on this one because I don't see it at the top of the screen. But however, we will have also this recorded. So after the webinar today, you will get an email. Wonderful, closed caption is there. You'll get an email with a link to the recording. And this is all handled by our colleague, Michael Busnack, who is really at the helm in managing these webinars and making sure that they are successful. So thank you, Michael. The other thing, you'll note that there is no chat function, but there is Q&A. So please go ahead and put in your questions throughout, and whatever time is remaining at the end, we will try to have a few minutes at the end for questions and answers. At this point, I'd love to turn it over to my colleague, Patrice Nicholas, to introduce herself as well as our speakers. Thank you.
Thank you, Winnie. Welcome from the MGH Institute of Health Professions, Center for Climate Change, Climate Justice and Health, and also Senior Vice President and Chief Nurse Debbie Burke on behalf of the MGH Department of Nursing and Patient Care Services. And David Hanachak has kindly offered to introduce our speakers. Thank you.
So I guess that's my cue. Thanks for inviting us. We're going to talk about our sustainability approach in planning a new building at Mass General Hospital here in Boston. I'm VP for real estate at Mass General. Also, we have here Nick Haney, who is a project manager on the building within the MGH planning office. Peter Alspach is from our architects, NBBJ, who focuses on sustainability and resiliency systems. And we may or may not have Margaret Montgomery also from NBBJ, who focuses on sustainability. So I'd like to start with just a brief overview of the project. We do have a lot of slides. I'm going to be fast. But why did MGH embark on this project and how the project has evolved? And what I hope to get across is that while our focus here is on sustainability, the project does continue to evolve as we balance a set of goals and demands that are placed on the project by users, by regulatory bodies, by community, and by other interest groups as well. So that juggling and that balancing continues until we can actually get in the ground and started. MGH mission is really focused on obviously clinical care and community care and research and teaching. Let's keep moving. There we go. And we do have a set of principles that we follow. Again, it's focused on patients. How do we provide care? How do we use the building, not just as a building for the specific occupants, but how do we use it to change care across the institution? Flexibility and adaptability obviously is of key importance now that we are suddenly in a different respiratory disease type of world. And I can mention how some of our changes adapt to that. How do we improve the experience for our staff, for instance? And how do we try out new technologies? We also have to make it fiscally responsible, and I will touch on that as well to some degree. And why don't we keep moving here? So the building started at least 5 years ago now, though I know I've come across some documents from 2013 that suggest we were actually thinking about it then, to deliver state-of-the-art care We have an increasing demand for care. At the same time, we have real capacity issues. In particular, we see that, well, across the board, but particularly in the emergency department where we have frequent boarders. One of the reasons for that is that we have 38% single beds in the hospital, and we are closing 30 to 60 head wall beds per day based on infection, gender, behavior, hospice, any number of things. Plus, we are working in some obsolete buildings providing care. All of that needs to be upgraded. We're also putting together, consolidating two programs, cardiac and cancer, as centers of excellence within this building, and using that to consolidate and develop their programs. I will, again, obviously we're going to be touching on sustainability and resiliency, but we need to be available for the hospital in ways we are not prepared to at the moment. Next, please. More specifically, you can see our site on the left and an image encircled on the right. There are, this is basically 2 blocks of a podium that I will describe in a moment with 2 bed towers on top of that. The buildings will be phased because we need to keep existing hospital operations ongoing. And the site is right on Cambridge Street, if you know Boston, and surrounded by North Grove, the main entry to the hospital, Parkman that runs along the north side, i.e. towards the upper left, and Blossom Street. This is the only place to place these buildings on campus with minimal disruption to existing operations. This is not a small building. This is about 1,000,001 square feet plus a large garage, so this is an operation. Next, please. So included in the building are 482 beds. That's a net new of 94, but the actual opportunity to not have to close 30 to 60 beds per day makes this more significant than it looks. Full imaging modalities, 24 ORs, 120 exam rooms for cancer, plus 100 infusion bays. We have full support services because the intent is that this building will be a place of refuge for the hospital if we are in a full disaster. It is set up to maintain 96 hours in island mode, and yet still be able to provide services both to the existing patients and any emergent patients that can make it to us at those times. We also have a variety of needs that are directed by the city, including a MBTA head house for a planned Bowdoin Street to Charles Circle connector between 2 subway lines here. We have 900 plus parking spaces, of which 175 are new. We are more than doubling our existing bike parking and a variety of other services, both community, urban design, and hospital-based. Next, please. And over the last several years that this project has been developed, we've had to slow up a bit. Part of the reason for that was COVID, and part of that was discussions with the community. We needed to consider what we would change based on what we've learned about the diseases we're likely to face in the future. Given a variety of movements and the disease itself, what can we do with our commitment to public health equity and climate justice? And then how does that relate to resiliency and sustainability? We have had a significant amount of dialogue with the community, state officials, neighborhood organizations. These are but some of the major ones. And frankly, everybody has a set of perfectly valid needs that we are trying to address. Next, please. Which brings us into one of our major challenges is how do we balance the goals and resources? I'll start that by saying, obviously, we have the clinical drivers for the process and the severe constraints, capacity constraints. We're replacing obsolete facilities, and we use this building to be able to decompress programs currently within the hospital and to rationalize them so that they can expand the acuity services within the hospital. At the same time, we are moving programs that can legitimately move off campus into neighborhoods, off campus through other programs and other developments within our system. On the regulatory side, we have significant mitigation, both financial and in terms of a variety of functions, whether that is bike traffic, the MBTA requirements for providing neighborhood services, such as developing a community center for a local group. And we're going to be looking at bringing in affordable housing. So simply from a neighborhood perspective, this is not insignificant. We also have something we call the Anchor program, which is to use this project as a catalyst to improve underrepresentation for women and minorities in construction projects within Boston. That too is an ambitious program. And all of these take significant resources. Resiliency, I mentioned, 96 hours in island mode. But we also are hardening the facility against a variety of issues. Wind, actually, I think Peter will touch on this shortly, but not the least of which is blast protection and a variety of vehicle intrusions, since we are considered one of a high-class target for terrorism. Sustainability we will get to. And I will mention the counterbalance to all of that is the resources. We have a fixed budget. We have a fixed schedule as much as possible in order to get this operation up and running. At the same time, we are in the most highly volatile construction market. Escalation is currently projected at 6% per year. That is representing something on the order of $8 to $12 million per month for us. And Boston is the 7th highest construction city, not in the country, in the world at this point. So we are in an extraordinary time where it is very difficult for us to figure out how much money do we really have and how many resources do we have to put towards completing this building, which is a short way to say all of these elements need to be balanced. So next, please. And I believe, Peter, are you taking over at this point?
Yeah, sure. I can take over from here. So we wanted to talk about some of the sustainability and resiliency priorities first, and then we'll get into some of the more details around each of those topics. I think one of the starting points for me is to look at the length of the project design and construction duration, as well as the expected length of the project's lifespan. I think that both of those have a significant influence on the drivers for the project and how we go about the process, especially around sustainability. We've got a 12+ year planning and design and construction process, and things change during that, and that is something that we've had to be fairly nimble about, even during the design phase, looking forward out to 2030 and beyond, to make sure that our sustainability and resiliency goals for the project align with the kind of changing landscape, both regulatory and legislative, as well as the changing climate that is being projected out into the future. I think one of the good things about projects that are kind of forced to take that long view is that long view forces you into a mindset around sustainability and resiliency that sometimes quick burn projects don't take because they're so focused on the near term. When we look at resiliency, David mentioned the 96-hour island mode, and that's really driven by this mission to provide a community support system for the MGH community within the new Cambridge Street project. So as we started to look at that, we looked at first, what are some of the disruptors that are out there? You'll see a lot of them are climatic disruptors, which is not surprising given the potential for climate change that we are seeing. We then mapped those into threats, working with a number of experts to identify the threats, particularly climate change threats, but also seismic and, as David mentioned, blast and terrorism threats, and use that threat analysis to set design goals for the project around resiliency, with that ultimate end game being this 96-hour island mode operation, which is basically like if everything collapses around the building, you know, perhaps literally, perhaps figuratively, the building can still remain up and running at reasonable functionality and capacity for at least 96 hours while contingency plans get put in place. And that provides a real island of support for the MGH community as well. Sustainability went through a similar process, looking instead at different lenses, as is the term that we used as we started to initially charrette these ideas with the leadership at Massachusetts General Hospital, identifying energy and carbon, indoor environmental health, water and waste and the circular economy as big lenses that then drove issues and again goals for the project. Ultimately, sustainability kind of gets represented for better or worse through LEED certification. It's the most recognized certification out there in the world, and so something that the project team is looking at to certify and bring up some third-party rigor into how we're doing around sustainability in particular. So doing a little bit deeper dive into resiliency, going into this 96-hour mode. So when we talk about 96-hour goals, we have to start looking at all the different systems that are in place that support the hospital and setting goals for them, and then figuring out technical strategies to back that up. So we have to look at power and heat and cooling and how we get water and what we do with our waste and how we continue medical gas continuity and IT continuity, how we deal with campus emergency operations. These are all different things that go in, and then surge capacity is something I think that is important, because with the investment in this facility, we want to be able to accommodate additional patients under an emergency scenario from other buildings on campus that are less resilient than this one. Some of the key things that I think are worth talking about around the resiliency performance that are somewhat new to the campus, and some of them are new to hospitals, particularly in the Northeast region. We are providing multiple layers of backup heat. So we have multiple steam connections for the project, provide one layer of inherent resiliency, but then we also have fuel oil boilers as a backup to the steam, because a seismic event or some other disruptions may actually impact the ability of the hospital to receive steam. So we wanted to make sure that we have a backup, kind of a backup for the backup, if you will. Cooling is something else that, you know, some people forget that it actually takes a lot of water to cool a building. Cooling towers that are used to reject the heat from inside the building consume a lot of water. And so to maintain that 96-hour goal, we actually have 650,000 gallons of water storage for the cooling system that is available at all times should the water supply to the building be disrupted. Likewise, we also have 75,000 gallons of potable water storage on site that is available to serve the building through the plumbing system, so that staff don't have to, you know, walk around with carts of bottled water just to deliver some of the basic needs during this 96-hour period. I do imagine there'll still be bottled water being used, but that 75,000 gallons really eases up some of the operational pressure on that. And then we also have the sewage tanks to store the waste from that water on site should the wastewater system at the municipal level be disrupted, which is a likely event in a flood. As we talked about, you know, there are a lot of climate drivers as well. Flood is one of the biggest climate change drivers that we looked at. It has a significant impact on this part of the campus. And the design response has been to, you know, move out of the way whatever we can move out of the way. So like the electrical infrastructure is not in the basement, it's up elevated, so that we don't have to worry about the risk of flood damage to electrical infrastructure. And then the things that we can't move, we do have a hardening approach to the facility to make sure that we can keep the water out, whether it's keeping water out of the lobby or keeping water out of the below-grade pharmacy and parking garage so that the pharmacy and food services can continue to operate in their location. Temperature rise is something else that we're seeing across the country this year in particular. And we have actually used climate change projections to size the mechanical systems for the project. We've looked at the facade design to withstand the projected Category 3 hurricanes that may be coming. Seismic is something that is not climate change driven, but is something that is becoming more on the radar of the Northeast, despite the lack of it being seen as a typical seismic zone like California. And then the security upgrades, we are trying to keep those confidential so that you don't want to tell the enemy where your weaknesses are, right, and where your strengths are. So we're keeping that confidential, but there have been a number of upgrades on that front. Looking at the sustainability of the project, as I mentioned, LEED certification is part of the process. Right now, we are heavily in the LEED Gold level, which is what we're viewing as the minimum certification level for the project. And we are striving for LEED Platinum certification. As David mentioned, we're in design. There are still a lot of pieces moving around. So we are striving for LEED Platinum. We don't have a surefire path there, but we think we're going to be able to get there. So we're working our hardest to get to LEED Platinum. And some of the areas that we are looking at, we've got a little bit of opportunity on the water side, but most of the opportunity to move the project upwards around sustainability is related to energy, in particular renewable energy supply at the kind of system level, at the MGH system level, the materials of the project and how we can reduce the embodied carbon of construction, which is something that I'll get into a little bit later, and also the indoor environmental quality. So wanted to do a deep dive into carbon here in particular. I know it's a very hot topic. The IPCC new report just came out, really emphasizing the criticality of the situation. And I actually live in Seattle and on the West Coast, and we are, in the thick of climate change driven events right now as well. I do think it's worth kind of stepping back from the project a little bit and talking about what MGH has achieved to date. MGH set a goal of reducing energy consumption at a campus level by 25% by 2020. MGH has vastly exceeded that goal. I think MGH hit that goal in like 2016 or something like that, and now is at a 36% reduction from 2008 levels, which is really fantastic. It means that there's a lot of work being done at the whole campus level, not just looking at new construction, because there's a lot of existing energy and operations that are being really optimized and fine-tuned as the campus moves forward. So when we look at new construction projects, we kind of break carbon into two buckets. One is embodied carbon. Embodied carbon is the carbon that is emitted as part of the construction of the building. So then the concrete and the steel and the aluminum and the insulation and all the materials that go into the construction of the building, those all require carbon to, make them, to move them onto the site and to actually build them. So that's the embodied carbon. And then operational carbon, we generally in the new building world are really just looking at the energy consuming systems of the building. So when we talk about operational carbon, we're not going to get into waste and material supplies and some of those things. They are important, but for this discussion, we're just going to focus on the energy systems and how we get those to a zero carbon state as well. I'm actually going to start with the operational carbon. It's the carbon that I think most people think of when they think about carbon emissions from buildings. And we take kind of a 4-step process when we look at it. Number one is we start with a high performance envelope, reducing the loads that are imposed on the energy systems of the building. The environmental loads are one of the predominant drivers of energy consumption within buildings. Keeping the heat out and everything is really important. And then looking at how those systems are put together to use that energy responsibly. And then we look at something called electrification, which is we're trying to use electricity as much as we can because the state in particular is looking at 100% renewable energy supply by 2050 for the electrical grid, right? So if we shift loads to electricity now, as the electrical grid gets cleaner over time, the carbon footprint of those loads goes down with the electrical grid. And that's one of the biggest drivers around the project energy systems design. And it's a somewhat new concept within building design. And I think it's an important concept to get our heads around. And what it does is it leads to that last step of decarbonization, which is the supply of renewable energy. That can be done on-site or off-site. When we look at how energy is used in hospitals, I think it's important to look at how energy is currently being used in hospitals. So this is a fuel mix survey for Boston area hospitals that shows that right now about 60% of the total energy being consumed in hospitals right now is fossil fuel driven, a combination of direct natural gas use and steam consumption, and about 40% is derived from electricity. That has a significant carbon footprint because that 60% is coming from fossil fuels, right? And we're trying to divest ourselves from fossil fuels as much as we can. The current design of the Cambridge Street project is 85% electric and 15% steam, which is, I think, an amazing transition from the status quo, which we see here on this chart. When we also look at energy, we, in the energy world, use an acronym called EUI, which is energy use intensity, which is the amount of energy consumed per square foot of the building per year. So it's given in units of 1,000 BTUs, kBTUs per square foot per year. Is kind of a wonky energy mix that's unique to America. For those of you that might be outside of America, I apologize for the use of English units, but that's where we are. The current average for existing hospitals in the Boston area is about 265 kBTU per square foot per year, and of that, about 183 is derived directly from fossil fuels. Mass General's main campus is lower than that. The energy use intensity is about 240, with about 140 of that coming from fossil fuel loads. And when we look at the new building design, the new building energy use intensity is 173, so a pretty significant reduction from that average, and even the average of the campus, but it's also a 25% reduction versus the current energy code. And when we look at the shift to electrification, what that means is that we take that 85% that is electric, and with 100% renewable electricity generated both on-site and off-site, we can reduce that real energy footprint down to just 26 kBTU per square foot per year, which is just about 1/10 of the average for an existing hospital, which is really just a fantastic achievement in my opinion. So how do we get there? Well, as I mentioned, we start with this high performance envelope. Windows are the weak link in most building envelopes. Glass is something used in cookware. It's not something used in insulation products, right? So we want to keep what we call the window to wall ratio low. So the amount of glass in the building low. And then where we do have glass, we want it to be high performance glass. So we've got triple pane glazing throughout the project. And then we've also paid particular attention to how the building is constructed in terms of keeping an airtight envelope. Air leakage is something that not only causes energy to leak in and out, but also can cause moisture problems in a building, which can lead to condensation and mold growth and all kinds of bad health outcomes. So an airtight envelope is incredibly important and part of this high performance envelope. When we look at the systems, we've got a very advanced chiller plant generating the cooling. And we're even looking at the refrigerants, the global warming potential of the refrigerants. So refrigerants that are used in air conditioning systems can have very, very high global warming potential. And we're using refrigerants that have a very, very low global warming potential, which represents a really significant savings. And then advanced controls and metering and very efficient lighting are some of the key things. But I want to really focus on this electrification. So one thing that I think is kind of a small but significant thing that we're doing is we've gotten natural gas completely out of the project. So cooking for this project will be done on induction cooking facilities. So that, number one, gets natural gas consumption out of the project and electrifies and allows for a renewable energy supply of the cooking. But it also improves the health of the workers in the kitchen because we don't have those fumes coming out into the kitchen. It improves the comfort of the kitchens as well. There's a lot less heat, waste heat given off. So there's a lot of wins that are small but significant wins around the electrification of cooking systems. But we've got this big system in here that is pulling heat out of the exhaust air of the building. So buildings breathe, right? So we're constantly pulling air into buildings and exhausting air out of buildings to keep a healthy environment inside for the patients and the staff. And all that air that we're throwing out of the building is being exhausted between 70 and 75 degrees. So it actually becomes a really great heat source for us to capture. So we're capturing all of that heat from the exhaust air, running that heat through a heat pump like you might have in a geothermal heat pump, and using that to both heat hot water for domestic hot water that comes out of the tap, as well as provide heat for the air that's coming into the building. And it's really dropped the heating demand of the project significantly. That's the number one driver that's allowed us to increase that electrification and drop the steam usage. So much so that, if we look at this graph, the red and the pink are the only times of the year where we're using steam. So we've eliminated steam usage except for these very, very cold event days where we can't recover enough heat to heat the building. And we also have steam for humidification and process, which is the light pink. And those are needs that are driven by health and safety for the project. When we talk about electrification as well, we think about steam. Steam right now is fossil fuel derived, but as we go forward in time, the steam utilities are looking at how they can electrify and reduce their carbon footprint. So one of the advantages of hooking up to a district energy system like we have for steam is that we can take advantage, along with all of the other customers, to upgrades in the central infrastructure of those district systems. And that's something that is, I think, an important part of the decarbonization of not just this project, but also the entire MGH campus. And then lastly, it comes down to renewable energy. We are putting on a modest on-site rooftop solar array where we can. We have a lot of mechanical equipment on top of the roofs. The lower roofs are all reserved for patients, so we don't want to put solar panels where we want to get patients and staff outside onto roof decks and roof gardens. And so there's a commitment to renewable energy from off-site sources. Right now, MGH is looking at how to procure that renewable energy for the future. When we look at embodied carbon, again, as I mentioned, this is like how the building gets built, right? And so we're looking at, again, kind of a four-step process of looking at low carbon materials selection. So selecting the right materials to begin with, taking a life cycle analysis view of materials in the project, and then looking at low carbon procurement. How we actually buy stuff is actually very important and can have a huge impact on the carbon footprint of the project. And then lastly, obviously, there are carbon offsets that we would need to do to get to a zero carbon scenario for the embodied carbon. Looking at the kind of magnitude of embodied carbon right now for the project, our contractor took a look at our current design, at just the kind of structure and facade right now, which is the majority of the embodied carbon. And we're at 372 kilograms of CO2 equivalent per square meter of the project. That is of some limited scopes. I'll talk a little bit about the scopes. When we end up, we're probably going to be ending up somewhere around 560 to 620 kilograms of CO2 per square meter when we take a comprehensive view for the project, which is driven a lot by steel and concrete. Steel and concrete are the #1 and #2 sources of carbon. Concrete #1 and steel #2. When we look at low material selection, right, we've got a number of tools that we can use, and we can start to look at things. We focus obviously on the concrete and steel, but also look at finished materials and things like insulation. Insulation gets, most insulation is blown with gases, and those gases can have greenhouse gas potential, and so we can look at low carbon insulation products as well. So making the right choices, smart right choices at the beginning sets the stage for the later parts. So what is whole building life cycle analysis? So a whole building life cycle analysis takes an analytic view of the entire life cycle of the building itself, right? So it takes a look at the carbon that goes into the initial construction, but it also looks at how those materials need to get repaired and replaced and maintained over time, and then what happens to them at the end of their lives. Are they just a landfill product? Do they decompose in the landfill and emit methane? Can they be recycled or recovered? These are all parts of a whole building life cycle analysis. And whole building life cycle analyses also look at things beyond just the carbon footprint, right? We're looking at the impact on air quality, we're looking at the impact on ozone depletion, on eutrophication, on the toxicity to humans and the environment of all of these different materials. So it's a very kind of comprehensive, long view that I think lets us make smart decisions. And that's really the point of this type of analysis, is to get the data in so that you can make smart choices to help reduce the footprint. And then lastly, is the procurement side. And this is something that is relatively new in the industry. It's been going on for just a few years. There have been some industry trade groups and university research groups that have partnered up to look at how we can start to get the data on the embodied carbon of materials. And then once you've got that data, you can start to select the best providers of the same performance. So if you look at a 3000 PSI concrete mix, you can say, okay, well, here's the embodied carbon of our 3 different bidding suppliers, and we can choose our suppliers based not just on price, but also on their carbon performance, and drive the market in that way and start to choose low carbon solutions, not just from the initial material, but also who is selecting, who is providing it, where that material is coming from. Is it being trucked across the country or is it local? All these different things go into that. So when we look at putting this all together from a carbon perspective, and these are pretty rough numbers. There's a lot of moving parts, especially around the steam emissions in the city of Boston. But if we look at kind of a baseline building for the project and look at the proposed building, we're looking at about a 65% life cycle carbon emissions reduction going out to 2050, which I think is really phenomenal for this project. And I think we can even do better when we get some more savings realized on the embodied side. And we're not going to see those till we get the procurement done, but I think that's a big piece of it. And with that, I want to wrap up and leave enough time for questions, because we've just skimmed the surface on a lot of topics, and I know that there are probably a number of questions out there, so we want to leave time for that.
Thank you very much, Peter and David and Nick. I know you had your hand in this as well. It's I think very helpful to the community to see some of the thought processes and some of the design changes that the building has undergone in the last number of years of its development, even before we've put any shovels into the ground. So it's my task here to help to moderate any questions that folks might have. So as Winnie had mentioned at the beginning, if you want to put any questions in the Q&A function here in Zoom, I'll be happy to see them and then direct them to our speakers. I'll start. We have a fairly large question here, so try and consolidate as best you can into a brief answer. Maybe this one's best for both Peter and Dave. The question being, with the city of Boston and likely the Commonwealth moving towards net zero building standards, what's the plan for this building to be net zero by 2050?
I'll start maybe, and then David, you can chime in. So the biggest piece of that has been this move towards electrification. The city of Boston has identified that electrification is one of the big shifts that they want to see in the transition to net zero carbon buildings. And we've actually been working with them quite extensively on this project, and this level of electrification, getting this 85% electrification is in alignment with the City of Boston goals for net zero by 2050, because we can use offsite renewable energy and the renewable energies that are being built into the grid right now to zero out that 85%. And then Vicinity Steam, who is our steam provider, also has regulatory requirements to get their carbon emissions reduced by 2050 as well. So when you put those two things together, that is the solution to net zero energy for this project. I don't know if you want to comment further, David, about some of the renewables.
Yeah, sure. On the regulatory side, yes, our intention is to be carbon free by 2050. Obviously, the regulatory environment is evolving. We are part of a consortium of a conference of Boston teaching hospitals that has a position on that regulatory development. There's some comments. Hospitals have their particular sets of issues, and I think this is going to play out as a policy and legislative event. It's going on right now, and we're trying to understand what that is and adapt to it, but it is current. So keep going, Jonathan.
Okay, thank you, Dave and Peter. There's a question here about, I think, getting at the building life cycle assessment method and scheme, and what the boundaries are included in that. The questioner specifically asked about emissions from, say, medical waste or waste anesthetic gases, and how that's included in that building life cycle assessment, and then how that would potentially be mitigated.
So the building life cycle assessment that we are performing on the kind of hard design and construction side is really only about the materials that are going into the building from a construction standpoint. So we have unfortunately not been looking at the kind of waste and anesthetic gas usage. I know there are people at MGH who are doing that, and we've been in conversation with them, but that's not been part of my world, at least. I don't know, David, if it may be part of your world.
I think Jonathan can probably answer that question better than the rest of us at this point.
Thanks. I'll let that one go for now. Just to
Gases are something that can't be overlooked, though. So.
Yeah. The short answer is that waste anesthetic gases are a huge factor for the hospital's Scope 1 emissions, and we're working on that. But I don't want to take too much time out of this session to get down that rabbit hole. Let's see. I think that the next question that I'm curious about as well is we heard you mention that one of our factors is resiliency, and that we've incorporated quite a bit in the way of fuel-driven generators to maintain the 96-hour island. What consideration was there, or can there be, towards non-fossil fuel-driven generators, thinking perhaps of fuel cells or chemical batteries or some other on-site means to store energy for the island function?
Yeah, so that's it's a kind of a tough question, because the technology is evolving quite rapidly in those spaces. And one of the things that we have to look at when we're evaluating new technology for a healthcare facility is how robust is that technology, right? We need to have something when we're excuse me, when we're relying on a supply for a rare critical event. We need that to be like, that's our last stand, right? We need that to be as reliable as possible. And right now, fossil fuel generated electricity and heat is the most reliable source. If we look at fuel cells, most fuel cells right now, unfortunately, run on natural gas. So they ultimately have a fossil fuel source. There are some that are running on hydrogen, and I think hydrogen, as we look out into the future, is going to be probably the best source of energy dense energy storage for these types of operations. But hydrogen storage and clean hydrogen generation and the hydrogen backup power equipment and heating equipment is not at a mature place right now within the building construction environment, unfortunately. And batteries are another complicated rabbit hole. Lithium-ion batteries cannot be installed inside a building. They're an extreme fire hazard. If you've seen any of the car fire videos that are out there. There are some other battery technologies, but they don't have the magnitude of storage from a space perspective to make it feasible to do it. The energy density is really what's key for the fossil fuels.
Okay, thank you, Peter. We have a slightly different topic, thinking of, instead of energy, thinking of water. And there's a question trying to balance our need for infection prevention and maintaining a healthy environment against potential water use and perhaps what could be considered excess water use. So the specific question is, will the water fixtures in the new structure be low flow? And how do we balance that against maybe some limited evidence that they can harbor drug-resistant pathogens?
So I know that we are looking at low flow fixtures in general, but we are not looking at the lowest of low flows. So our plumbing engineers that are working on the fixture selection are well versed in healthcare design. So it is, I think, as the questioner pointed out, it's a balance of water conservation and health and safety, right? So we're always trying to make good judgments and balance that line out. I know that's kind of a big answer, but that's the best I can do at this point. So.
So another example, this may be becoming more current, and we're watching a situation. Another hospital system within Boston is building right now. The proposal there is to eliminate public drinking fountains as infection infection sources. Right now, the codes do not allow that to happen. I don't know if this is going to be appealed or if that is going to be an issue, but it's something, again, we're watching closely. So some of this becomes very detailed issues that get wrapped up in interpretation, who's interpreting, when, how is the application made. So.
Okay, thank you. Have been a couple of questions looking, now we're getting kind of pretty specific here about vehicle charging stations, so electric charging stations, and what kind of opportunities there will be in the new building. Can you talk a little bit about that, both knowing a little bit about the design, I'll add specifically about, let's say on opening day versus what can happen later?
Yeah, so on opening day, the city of Boston actually requires 25% of the parking stalls to be EV charging stations, which is about 3 times what we see in even the kind of best market rate EV charging garages that are out there outside of the city of Boston. So 25% is a fantastic starting point, and there is infrastructure to go beyond that. But 25% is the starting point.
And to continue that, the infrastructure is for the whole garage to be ready for conversion to EV charging.
And then remind us, so 25%, the garage is, I want to say something like 900 spaces, is that right? So,
right now,
25.
Right, 929 divided by 4.
Right. So, we're talking about, well more than 200 spaces.
130. Yep.
Yeah. Okay. Question about electrification and where we're sourcing our renewable energy. And we mentioned the rooftop solar, which really on the scale of this building is going to generate a relatively tiny amount of electricity. It really quite tiny. So we're really talking much more about our offsite renewable energy sources, and Mass General Brigham has been sourcing renewable electricity specifically for MGH for at least the last 3 to 5 years, 100% of our electricity. Obviously, this will need to add to that demand for renewable electricity. Can we talk at all about how local these local sources are, and what potential there might be to expand what we're currently purchasing?
Maybe better for me to take that one, Peter. Currently, there are efforts within the Mass General Brigham system as a whole to develop those options specifically, but they are in process and in negotiation. So I neither have full knowledge nor could I reveal knowledge I have at the moment about it. But yes, the intent is to both broaden and expand and create as much local as feasible. So that an ongoing program, my guess is we'll be hearing more about that within a year.
Okay, thank you, David. Let's see, I'm just kind of scrolling through. You mentioned, Peter, that that the current plan is about 85% electric, 15% steam sourced energy for the building, with that 15% being from the vicinity cogeneration plant in Cambridge right now. How much are we relying on vicinity meeting their regulatory burden and expanding their, or transitioning their, or quickening their transition away from fossil fuel driven steam versus actively working, and if so, how, to kind of get that transition to happen more quickly?
So right now we are relying on vicinity to make those choices. They have plans that are active right now to electrify. They're contingent on a lot of pieces moving together. But I know MGH is also having conversations with Vicinity, but I am not part of those conversations. I can't really comment on where they're going or what the drivers are for that.
I don't know, Dave, if you have anything to add there, or if that's another area where we're really kind of in need of the MGB energy services kind of perspective that we just don't have with us today.
Yes, but it's also, again, it's discussions between Vicinity Steam and DOER that we're not a part of. It's discussions with developing legislation, both city and the city of Cambridge and the states. So, you know, again, a lot of moving parts at this point. I don't know where that's going to end up. We believe everybody's interest is to get to the point of electrification, and you know, at this point, we need to wait and see as well.
Great. And then I'll just, one last question. I think we have a couple of minutes left is, Peter mentioned that we're currently at about 74 points of LEED credits, which easily qualifies this project for LEED Gold, and that it would take at least 6 more points to get to LEED Platinum. Can you talk at all more specifically? I know that you had that slide that gave kind of the general big picture where those points could come from. Are there any specific items that would really help that transition or get those extra points?
So the two big areas that we're looking at right now, one is, as David mentioned, that ongoing offsite renewable energy procurement, depending on how that plays out and what category of offsite renewables is purchased, that has a pretty good swing for us. And then the other is looking at the embodied carbon, and depending on how much we can save on embodied carbon, that will also make a big difference for us.
And when you say embodied carbon, you're really talking about construction materials there.
Construction materials, correct. Yeah. So a lot of it comes down to concrete and steel procurement, to be honest with you, right? And as David mentioned, the market is absolutely insane right now. This project requires a lot of concrete and steel, so hopefully we have some market leverage through our contractors, but at the same time, we have to be cognizant of what additional price we may have to pay to get the low carbon version. And that's, again, one of those balances that David was alluding to earlier of, you know, trying to thread this needle of, you know, environmental responsibility and fiscal responsibility.
And is the material available at all when we need it? And is it reliable? So is it tested in that whole structure? We're looking at that. What will be available in a year or 2 or 3 when we need it? Again, that's market volatility. We don't know, but we are probing and testing the waters and talking with a variety of material suppliers at this point.
Okay, thank you. So it's 12:59 now. I'm going to turn things back over to Winnie. Thank you all for your participation and especially for the questions that people have been asking.
Thank you, Jonathan. And I just want to say Jonathan Slutzman is the director of the MGH Center for the Environment and Health. So that's who he is. Thank you so much, Jonathan. And also big thank you to all of our speakers, Peter, David, as well as Nick, who I know was very heavily involved with these topics as well. I just want to make one quick announcement. The slide, I apologize, the second line got cut off. So the next month's webinar on September 15th at 12 o'clock Eastern time is going to be, the full title is Healthcare's Responsibility at the Intersection of Climate, Health, and Racial Equity. And so I hope that you can join us there. Thank you, everyone. It was a pleasure to have all of you join us. Thank you.